Greetings everyone, I'm Dr. Suchismitha Rajamanya, Lead Consultant in the Department of Internal Medicine, Aster Whitefield Hospital, Bangalore. With the onset of summer season and the soaring temperatures, it's important for us to understand the kind of diseases or ailments that we would be predisposed to and brace ourselves for protection against them. So with the soaring temperatures, we find that there's a host of health ailments and infectious diseases which are on the rise. For example, there's an increase in the number of foodborne infections. This includes infections like typhoid, hepatitis A, cholera, and a host of other viral and bacterial infections which can cause acute gastroenteritis and dysentery. These usually present as loose stools, fever, nausea, vomiting, pain abdomen, and jaundice. Apart from this, we also see that there's a rise in the number of respiratory tract infections. So this could range from upper respiratory tract infections to lower respiratory tract infections like pneumonia. So the most common organisms are various bacteria and certain viruses like the influenza virus, the respiratory syncytial virus, and in certain cases even COVID. Abrupt changes in the temperature like having a sudden downpour or changing from hot outdoors to cold indoors can predispose us to such infections. Also, the rise in temperature and the humidity can predispose asthmatic patients to frequent attacks. We also see that there's a rise in the number of viral infections like chickenpox, measles, and mumps, both in adults as well as children, and these can cause fever with rashes. Conjunctivitis or sore eyes, wherein the patients develop redness of the eyes with discharge, is also very common. Apart from the infection stated, we are also prone to certain damages because of the rise in temperature, like hyperthermia. Hyperthermia is a condition wherein the body's temperature rises to abnormal levels because we're not able to regulate the temperature from the environment. If this is not taken care of adequately or appropriately, it could lead to more fatal conditions like heat exhaustion or heat stroke. Our skin also undergoes a lot of damage, like sunburn and light-related photosensitivity, like rashes. Patients could also develop dry and itchy skin or peeling of skin. So simple measures could go a long way in protecting ourselves during the summer season. Adequate hydration is the most important aspect in managing our body during the season. Consuming at least 2 to 3 liters of water and electrolyte-rich fluids is very important. Avoid drinking too much of caffeinated drinks or alcohol, which can cause more dehydration. Apart from this, wear protective sun gear to protect yourselves from sun damage, like sunglasses, wearing caps, wearing a sunblock with an SPF at least 30. Wear fully covered, light-colored cotton clothes to protect ourselves. Ensure that you wash your hands regularly. Follow adequate and appropriate cough and sneezing etiquette. Wear masks, especially in crowded areas. Ensure that you clean the vegetables and fruits thoroughly with clean water. Consume boiled and cooled water. Have fresh food, preferably homemade as much as possible. Avoid high-intensity workout, which could lead to more exhaustion and dehydration. There are many vaccines which could help keep us safe from infections like typhoid, hepatitis A, chickenpox, and influenza. Do consult your doctors for the appropriate vaccination. So with all of these simple measures, we could ensure that we stay healthy during the summer. In the scenario that if you develop fever, loose stools, cough and cold, exhaustion or tiredness, do visit the Internal Medicine Department at Aster Whitefield Hospital for further evaluation and management.